All right. Well, when I looked in her ears, I could see fluid behind her tympanic membranes today, and she also has type B tympanograms, and that's consistent with reduced middle ear mobility, which is the indication of fluid. Usually a fluid attenuates the incoming signal and causes this type of conductive hearing loss. Consistent with this, I found a mild bilateral conductive hearing loss. Remember when I put that piece behind her ear during testing? She heard those sounds really well. And using that piece, I was able to bypass the middle ear space and test how the cochlea or the hearing nerve was responding to the sounds. That tells me that the fluid is causing a hearing loss. As fluid is in the middle ear cavity and attenuating incoming sounds, she will continue to exhibit a conductive hearing loss. Recall that you told me that she passed her newborn hearing screening, so I'm assuming that the conductive hearing loss is a result of the fluid.
So is the hearing loss permanent?
Well, I don't anticipate that it will be permanent. Permanent hearing losses are usually caused by damage to structures in the cochlea or the auditory nerve. And what I will do is, because she has a conductive hearing loss today, I do want you to go back to see Dr. Hamilton, and he and you together will figure out how to treat this. When he thinks her ears are clear, I want you to return for audiometric testing, and we'll make sure that her hearing returns to within the normal limits. And I'll verify that her hearing is stable before I release her.
So this is an ear infection?
Well, I cannot say for certain whether this is an ear infection. This is a conductive hearing loss caused by fluid in the middle ear cavity. I cannot say what type of microbial agent is in the fluid. It could be serous fluid, it could be purulent fluid.
Okay. So is there anything I can do to prevent these ear infections?
Well, we know that there are things that contribute or can contribute to fluid in the ears. For example, if children are in daycare, they're exposed to many microbial agents. And these agents can cause viral and bacterial infections, which can irritate the lining of the upper respiratory tract. And the middle ear space has a mucosal lining. So whenever the upper respiratory system is inflamed or there's negative pressure in the middle ear cavity, there's a risk that fluid can accumulate. So that can be something that can cause ear infections. Another cause could be smoking in the home. That can irritate the upper respiratory tract. Are any of these a factor for Alice?
Well, she's not in daycare, and no one smokes at our house.
All right, well, it sounds like you're doing everything. Some children are just going to be more prone. Children often get ear infections. It's not uncommon.
Okay, well, do you think it'll affect her speech at all?
No, I don't. But what I'd like to do is give you some language milestones of what kids should be doing at different ages. You can look at 15 months, what she's doing, 18 months, etc. And if you ever find that she's not keeping up, then I would like you to give us a call and we can get her in for some more testing.
Okay, good, because I'm a little worried that she maybe should be using some words that she's not using right now.
No, she's fine.
Okay, so we'll go back to Dr. Hamilton and I guess have him treat the ear infection?
Right. I want you to talk to him about the fluid behind Alice's eardrums. He'll talk to you about different options, about how to treat the fluid. And I'd like you to come back once her ears are clear and we'll retest her hearing.
Okay, so we'll come back when her ears are clear.
Yes. So first you set up an appointment with Dr. Hamilton, and I'll send today's test results so he knows everything that we found.
Okay. I've heard about tubes. Can you tell me more about that?
I can. So there are pressure equalization tubes. They equalize the middle ear pressure, and they're particularly useful when the eustachian tube has difficulty equalizing pressure. Pressure equalization tubes can also drain fluid out of the middle ear. They're very effective at doing that. So that's one of the options. It's a surgical option. If you and Dr. Hamilton decide that it's something you want to pursue, then he would send you on to an ear, nose, and throat specialist.
Will her hearing return to normal?
Well, as I've said before, I'm not certain that her hearing will return to normal. That's why I need you to come back and we'll retest her hearing. I do anticipate that her hearing will be back in the normal range, but I can't say for certain.
Okay.
Do you have any other questions?
No, I guess not.
All right, well, let me go get those language milestones for you, and we'll have you come back once her ears are clear, okay?
Oh, okay. Thanks.